Today I'm going to be talking about dialectical behaviour therapy, specifically on the topic of emotional regulation skills, understanding and labelling our emotions. I'm Dr. Anna Georgiadis, clinical psychologist for the Brent Clinical Psychology Service. Now we want to be thinking about a model for describing emotions. Now, this is very important because it can explain why we experience different emotions and how they come about. So it typically starts with having a trigger. This could be internal or external, whether you see something outside, say a car moving too closely to you and you might feel in danger, or this could be a thought. For the sake of doing this example first, we can assume it's an external trigger. So the next step in this chain is that once you have a trigger, this causes changes in our brain. And the brain sends electrical and chemical signals to the rest of our body. And this is what we experience as physical sensations in our body. This in turn leads to an action urge, a tendency to want to respond in a certain way, a certain manner. And this then leads to a specific action. And with that, we will have changes in how our facial expressions come about, what our body posture might look like, what words come out of our mouths. So with that action, in response to the emotion, we may have a secondary emotion. So as a little example, if there was an important event that I wanted to go to, but it was cancelled, I might feel sadness as my primary emotion, but you might actually see first my irritation or annoyance at that event being cancelled because I really wanted to go to it. So the chances are you might see me more irritable and angry, or I might shout. This is actually a secondary emotion, but what's underpinned by that is the primary emotion of sadness. And after the secondary emotion, we have our after effects. So those lingering effects in our body, whether we're feeling exhausted, tired, still having some irritability. These are the after effects, those biological changes in our bodies after we felt an intense emotion. And we can't sort of negate or exclude the fact that we have our thoughts, our interpretations regarding a particular situation. So whether it's the interpretation of the event being cancelled or a car moving too close to us and we perceive danger, this can also lead to changes in our brain and our bodily sensations. So we have to think about thoughts as well. In addition to this model, we need to think about our pre-existing vulnerability. Now, this includes how we're hardwired. So, some people are more variable in their emotions to begin with, and that's okay. That's just how they are. But if we're tired, we're hungry, or we're stressed out, we are more likely to respond to situations or stressful events with more emotional arousal. So we have to think about these fundamentals, our pre-existing vulnerabilities, and whether there's anything we can do to manage that as best as we can. And another thing we need to do is label our emotions. The whole point of this model is we're trying to start noticing what the sequence of events is in relation to our emotional world, and we want to be able to start naming and labeling what feelings we have. So in terms of treatment and what we do next, we've got our pre-existing vulnerability. Some people might say we can't change this if we're hardwired in a certain way. Well, even if we're hardwired in a certain way and we're still not getting much sleep, or we're still, we're hungry or we're stressed, we can think about actually what can we change. So in terms of reducing emotional vulnerability, in DBT, we have a number of specific skills that target this. And one of them is accumulating positive emotions. The other would be a skill called building mastery. Another skill that will help with this category of reducing emotional vulnerability is called cope ahead. And we've got please skills. Now, these are all part of the DBT program, and you can look into this outside of this talk, but these are just to let you know that those specific skills try and target reducing emotional vulnerability of that part of the model. The next aspect of thoughts, okay, what can we do in terms of DBT treatment to try and tackle or address thoughts that we have as part of this emotion model? So to change emotional thoughts and interpretations, we basically want to check the facts. This is very, very important because sometimes we might jump to a conclusion that just because we feel anxious that we're automatically in danger might not necessarily be the case. We need to check the facts. Of course, if there's a tiger in front of us, your body's going to be reacting automatically without the verbalization of thoughts and trying to weigh up, is it true, isn't it true? Your body is going to guide you and urge you into action without your sort of conscious awareness. But if there's certain things about, maybe suspiciousness of other people's intention towards you and you want to attack or shout at them, firstly, the idea is about checking the facts and slowing it down. In terms of the trigger component of this emotional model, we want to be thinking about reducing emotional prompting events. So if there's certain things in our environment that cause us stress and are likely to trigger us off. And so we suggest that the possible ways of acquiring skills in DBT is problem solving and thinking about distraction. These are the two main things that we would be thinking about in terms of trying to reduce emotional prompting events, which would be tapping into the trigger component of the model of emotions. Problem solving and distraction. Now, what about the next component, about maybe reducing emotional reactions and high arousal once we have them? We want to be thinking about crisis survival strategies, which are part of the DBT program and you'll be learning along the way, and also being mindful of current emotions. And if you actually are experiencing an emotion, we want to be thinking about using the skill of opposite action, opposite body language, and opposite words in order to help you cope once you're experiencing those emotions. So for this component of the model of once you're experiencing the emotion, these are the specific skills that you can look at and try and use in order to help bring your emotional intensity down. And the last bit of the model in terms of the emotion name, it's very, very important to describe your emotions by firstly noticing, identifying, labeling, and describing your emotions. And it's really helpful to maybe try and notice how your body is feeling, even if you don't quite have the words to describe or maybe label your emotions. Use your body as a clue to this and looking at all those different definitions of the emotions to try and identify which emotions you might be currently experiencing from moment to moment. This can be very, very helpful, as it can help you try and decide how you want to move things forward and how you want to respond. And in terms of secondary emotions and after effects, we want to be thinking about, of the emotion model, we want to be thinking about managing the after effects. And the skills that you would need in DBT to do this are distress tolerance skills, and you would repeat this for secondary emotions. So just to summarize, this we're trying to think about the introduction to a model to emotions. We want to think that it's important to identify and label our emotions. Emotions basically elicit motion. They guide us into action. Emotions are needed. They're very important. Emotions can communicate important information to us about ourselves and others. And the main emotions are anxiety, anger, sadness, happiness, and disgust. For each emotion, there is an appraisal and an action urge. Primary emotions can lead to secondary emotions and subsequent after effects. And each component of the model of emotion is associated with a different skill, DBT skill, that you can use. So you wouldn't want to be looking at that emotion model, that model of emotions, and thinking about which skill you want to be learning to try and tackle your emotional regulation. So I just want to say thank you very much for listening to this talk. I hope you found it helpful. Your between session task would be to try and practice mindfully observing and labeling what emotions you might be feeling. And until the next talk, take care and bye-bye.